गुड मॉर्निंग एवरीवन, वेलकम बैक टू अनदर एपिसोड ऑफ हेल्थ दरबार। तो आज हमारे साथ डॉक्टर अंजलि हैं, जो कल के ही हम टॉपिक पे कंटिन्यूएशन करेंगे अबाउट pelvic floor physiotherapy. And I request everybody to please put in your questions in the chat box. So after the session, we will take the questions. And before we start, I'll request Chalapati Rao ji to start the session with the morning prayer.
सभी सदस्यों को मेरा नमस्कार। आज मैं श्री नृसिंह मंत्र पढ़ता हूँ। उग्रम वीरम महाविष्णुम ज्वलंतम सर्वतोमुखम नृसिंहम भीषणम भद्रम मृत्युर्मृत्युम नमाम्यहम। भावार्थ है कि हे शूरवीर महाविष्णु, आपकी ज्वाला एवं ताप चारों दिशाओं में फैली हुई है। हे नरसिंहदेव प्रभु, आपका चेहरा सर्वव्यापी है। तुम मृत्यु के भी यम हो और मैं आपके समक्ष आत्मसमर्पण करता हूँ। धन्यवाद। ओवर टू सोनाली जी।
थैंक यू चलपति जी, इतनी सुंदर प्रेयर के लिए। सो डॉक्टर अंजलि, शुड वी स्टार्ट द सेशन नाउ?
या सोनाली, श्योर। ओके, so where were we? Let me just recap what we were talking yesterday on the pelvic floor physio and the importance in the women's health. So we were talking about the various aspects of कहाँ हमें pelvic floor physiotherapy पे ध्यान देना होता है, in terms of pregnancy, in terms of postpartum, in terms of menopause. So we did not touch the aspects of menopause. Now, menopause is the time when many women would have issues with pelvic floor dysfunction, which could be urine leak or severe constipation. And they also complain of osteoporosis, which sets in, and because of which the muscles and the bony structures also get a lot of wear and tear and changes in the body. So what is the importance of pelvic floor, especially for women who are in menopause or premenopause? We see a lot of these women actually are having a lot of sciatica kind of pain, a pain which is traveling down from the lower back into the hip and down to the lower part of the calf. And in those scenarios, we see these women are having very weak pelvic floor. And if we give them pelvic floor strengthening exercise, and we also work on their postures, which is because of the pelvic floor weakness gets also distorted. The hip muscles on one side of the body gets more weaker than the other side of the body. And that is why we give them a lot of exercises whereby they can strengthen their core, they can strengthen their pelvic floor also. And that will bring down the rate of pain and sciatica kind of symptoms for these women. Now, in menopause, as these women progress, and we see a lot of uterine prolapse coming up in the clinical practice, and we tell them how they should sit, how much weight they should be lifting, what kind of exercises they can do to prevent the prolapse of the organ. So what is in uterine prolapse and all? Basically, the organ structures which are around the uterus cavity basically tries to pop out from the pelvic floor because of the intrauterine pressure, or it's also because of the abdominal content, which is kind of descending down to the pelvic floor, which is not able to push back on the organs in the proper way, in the right way. So these women, when they want to walk or when they want to do vigorous activities, they always complain कि उनको urine leak हो जा रहा है, या they've gone to a market and as soon as they reach their home door, they feel like they have to rush for a washroom. And many of time, these women will have stress incontinence, urge incontinence. जैसे उनको लगता है कि वो पानी की आवाज सुन रही हैं या बारिश की आवाज सुन रही हैं, they feel like they want to go to pee. Definitely, whenever they do that, they're not getting the actual phenomena to pee, but they're getting a feeling that they need to do. So this kind of situations are very, very tedious during the situation for menopause. And once the women reaches menopause, again, the pelvic floor has a very good importance to strengthen, because the osteoporosis, the sarcopenia, which is the muscle weakness of women who are not actually exercising and who are very sedentary, causes the muscles to weaken. So we give a lot of emphasis on pelvic floor physio around that period, a lot of women will have very good knee muscle strength. They'll have very good knee muscle activity. We can prevent long-term damages which comes because of osteoporosis also. Now, coming to the PCOD aspects of pelvic floor physiotherapy, which we see in the young girls and the teens and going on later to adult life of a woman who's in her mid 20s or 30s or 40s, we see women are getting PCOD now. Now, what is the major role of like pelvic floor in helping PCOD and PCOS? We see a lot of these women are actually not exercising at a proper level, or they're not doing the right exercises which can help PCOD. So are they doing vigorous activities or exercises which involves high intense sports or high intense cardio, high intense gymming? All that is not allowed in cases of PCOD. We want to reverse PCOD. So, as pelvic floor physios and women's health physio, we actually tailor make their life and control basic aspects of the exercises they shouldn't be doing, and more emphasis on relaxing the pelvic floor, more emphasis on strengthening her core, and adding bit of muscle strength in the big muscles of the body. What are the big muscles of the body? Which are your thigh muscle, the quadriceps, and your upper shoulder muscles. So it has been seen that studies have shown that अगर ये मसल को हम strengthen करेंगे तो our control on sugar or our control on insulin is good, our control on PCOS gets better, our thyroid health also improves. So as a result, of women have a very good impact on helping a women to reverse PCOD. So that's a major role we see in cases of controlling PCOS or PCOD as a pelvic health physio. Now, many of these pelvic health physio would also see a lot of patients with long-term painful periods. So, हर बार एक लड़की का जो पीरियड आ रहा है यंग एज से, वो बोलती है उसको बहुत क्रैम्पिंग हो रही है, and she feels a lot of bloating in her tummy around the period's time, and she also talks about a lot of pain around the legs and the hips and the tailbone pain, and such a debilitating pain कि उनको उठना बैठना भी मुश्किल हो जाता है around the times when they're menstruating. Now, the pelvic floor physio का आज के जमाने में it's been a very impactful role in helping women with endometriosis, or it's called as painful period. Because पहले के जमाने में हम लोग बोलते थे painful period is a normal thing, but it is not. Painful period can be a sign that it means there could be underlying causes of endometriosis or very tight pelvic floor. So it's important to get assessed by a pelvic floor physio जो आपकी pelvic floor को समझ के देख कर they can understand if it's tight or if it's loose, because oftentimes endometriosis के time में अब women का pelvic floor बहुत tight हो जाता है, and as a result of that most of these women will common complaint होती है they're very constipated, or they once a week उनका bowels open होता है, or even if they open the bowels, even if they go for the pee and the poo, it's very painful process for them. And as a result of that, there's a whole saga of pain which builds up in their body. So apart from the time when they have pain during their periods, they have general gross pain around the hip and the tailbone and the buttock area most of the times. So हमारा जो role होता है pelvic floor physio के through, we try to kind of deactivate the painful point or the trigger points which they have around the pelvic floor. So उनका जो pelvic floor होता है बहुत spasmodic हो जाता है, बहुत tight हो जाता है, उस कारण से वो सारे जो structures होते हैं बटक के पास वो सारे compress होने लगते हैं, and they get very painful. So as pelvic floor physio, we help to relax the muscles, we help to kind of decrease the pain sensations for them, and their lifestyle or their quality of life improves drastically. पहले क्या होता था, they would depend on painkillers, but how many painkillers can you give to a person every month? If this is a phenomena over and over years में, so we cannot just keep giving them painkillers to control or manage such kind of pain which is coming because of endometriosis. So we give them this pelvic floor physio right from the time they start to feel the pain, and it has about 3 months time में ये जो program हम run करते हैं, and we can do it in a telehealth online medium also for various patients who cannot connect with me or with anybody face to face also. So these therapies have been a real boon for women who are suffering from period pains and also pains because they don't know what kind of pain is coming because the hip is always tight or the buttock is always painful. So pelvic physio is such a very important thing. And कुछ women जो athletic हैं और they run marathons और काफी सारे heavy weight lifting करती हैं या gym में जाती हैं, they have very tight pelvic floor because कभी कभी हम लोग डीप ब्रीदिंग करना भूल जाते हैं एंड एज अ रिजल्ट ऑफ दैट कई बार हमने देखा है कि पेल्विक फ्लोर काफी काफी टाइट हो जाता है बिकॉज वो स्ट्रक्चर्स को बैलेंस करने की हेल्प करता है. सो पेल्विक फ्लोर एक जो हैमॉक मैंने कल बताया था वो आपके स्ट्रक्चर्स को सपोर्ट देता है हिप के पास से एंड वो सारे ऑर्गन्स के लिए एक बाउंसी कुशन है बेसिकली आई टेल देम. तो अगर वो बाउंसी कुशन चला जाए तो मसल्स बहुत टाइट हो जाती हैं एंड योर ऑर्गन फंक्शन जो है हमारा डाइजेशन एंड ऑल एस्पेक्ट्स ऑफ द बायोरिदम ऑफ द बॉडी पूरा इफेक्ट हो जाता है. So such an important role we have in cases of pelvic floor. And I think we are almost reaching the time and I'll end the topic and we are open for questions. Thank you. Yeah. Over to Sonali. Yeah.
Thank you so much, ma'am. As of now, we don't have any questions on this. Shivani ji, are there any questions on Facebook or YouTube?
No, till now, Sonali ji, there are no questions.
Okay.
Anjali ji, I had a question that you were saying that we urinate during coughing and sneezing.
Right.
But then sometimes it gets better by itself, like over the months it gets all right, and again then it starts. So matlab maybe after few years you experience again that you are passing urine while sneezing, coughing or dancing. So what is this, why? Because initially beginning few years you had it and then it gets disappeared and again it take place. So what is the reason for this?
So majority of the times what happens is your postures, right? As I said, ki pelvic floor is affected by the postures of a person. And
Okay.
आपके postures में आप ज़्यादा बैठ रहे हो, how you're sitting, like if women are crossing their legs often, right? And they are having a constipated day, like they have been constipated and suppose they use force to evacuate. So all that distorts your pelvic floor function basically. And many of the times it depends on the food also, the diet which you've eaten, which irritates your pelvic floor sometimes. So a lot of irritants जो बोलते हैं हम लोग bladder irritants जैसे coffee है, caffeine है, a lot of fruits are there which can irritate the bladder of a person. And that also impacts your pelvic floor का जो whole activity है. And also day-to-day activities, your day-to-day postures, the way you sit, the way you're walking, the way you're driving your car, anything and everything basically. So many of the times क्या होता है कि हमारा जो uterus होता है and bladder होता है. So the uterus is in between your bladder and your bowel के बीच में. So sometimes when the women's periods are coming, तो ये uterus कभी-कभी starts to press onto the bladder, टेढ़ा हो जाता है. And in those situations, you'll see बैठते ही you are feeling like you want to pee. और बैठते लीक हो जा रहा है. So if the uterus is not sitting well over the bladder, it should be parallel to it. Should never be sitting on it, or it shouldn't be ever sitting on the bowel. So कभी-कभी because of wrong movements, wrong exercises, many times women कोई wrong yoga pose करने के समय they would distort the whole position of the uterus. So I usually in the pelvic floor sessions we have to correct this. And by correcting it, a lot of issues with urine leak or incontinence gets corrected. And a lot of women who have constipation, we can correct a lot of these issues just without a pill, just with pelvic floor physio, understanding how your uterus is inside the body.
Okay, it's
Just
depend
how
on how your posture. Basically, it's on your posture and how you are
Right.
sitting. And one more thing, sir, you experience more when you're on move, like you're dancing or you're doing cycling. Why is that?
So it's a activity which involves a lot of high impact sports, right? आप खड़े भी हो, and as I said, the pelvic floor आपको जब खड़े होते हो तो आपको balance करता है, आपके body structures को support करता है. So when you're standing, that pelvic floor muscles get activated. Now, when you're jumping and doing stuffs like that, many of the women might have undiagnosed diastasis recti. Suppose if they were pregnant and they have delivered a baby and they have a big tummy pooch, basically we call it the mummy tummy. वो tummy को अगर उन्होंने कभी उसको rectify करने की कोशिश नहीं की है, they've not gone for postpartum checkups with the physiotherapist, तो ये muscles अगर बंद नहीं होती है, तो it puts a lot of strain on the pelvic floor. So सारे organs pelvic floor के ऊपर ही pressure डालने लगते हैं. So when you stand up and you do any high impact activities, the pelvic floor के ऊपर तो pressure है ही, and those activities are causing more pressure. So that's when you start to leak in these activities. Basically.
So with this exercise can improve it.
So exercise with the right concept basically. So as I said, no, pelvic floor में पहले हमारे पास बहुत myths थे कि muscles weak ही होती हैं. But आधे से ज़्यादा आज के time में हम लोग देख रहे हैं क्योंकि every woman is sitting most of the time. तो pelvic floor बहुत tight हो जाता है. तो जो tight structure होता है उससे क्या होता है, जैसे कि डैम होता है ना, डैम से overflow होने लगता है. Whenever there is rains, the water just overflows.
Yes.
So a tight pelvic floor can cause a lot of overflow of pee and poo and all. So it's important to understand कि हमको relax करना है pelvic को या strengthen करना है. So वो pelvic floor physio देख कर ही, just with the facial expression of a woman, we can tell if the pelvic floor is tight or loose. जैसे आप jaw को खोल के रख रहे हो, बंद रख रहे हो, बहुत tight हो, tense हो, we understand the pelvic floor भी tight है. So depending on how person is presenting, we try to control this.
Okay. Thank you so much, Dr. Anjali, to make the concept clear on this. Thank you very much.
Thank you.
Thank you, Sonali ji.
Thank you. Thank you, Dr. Anjali, for a lovely session. We look forward कि आप हमारे साथ दोबारा एक session करें. So thank you so much for